Hot flushes are one of the most common symptoms that women experience when their hormones begin to change. And in this video, I'm going to share some strategies that you can implement to help manage yours. But spoiler alert, you don't have to wait for symptoms to show up to start to support and nourish your hormones. I'm Victoria, founder of the Women's Wellbeing Association and author of Reignite. And on my channel, I share lifestyle strategies and effective workouts for busy women who are looking to take control of their health and well-being without too much fuss, just simply and easily. I'm ridiculously passionate about breast cancer prehab and rehab, and also about hormonal health, because hormones are for life, not just the menopause. Hot flushes occur when hormones start to fluctuate and decline, and particularly when there's an imbalance between estrogen and progesterone. Up to 75% of women suffer with hot flushes, but there are so many lifestyle strategies that you can implement that can help, but it really is about a whole body approach. Now, HRT can help and has absolutely got a place, but not every woman can have HRT. Not every woman wants HRT. And even if you are taking it, sometimes you've got to do the deeper work as well to really get the full impact of that intervention. If you're experiencing hot flushes, you sometimes need to start before the start, and don't overlook the basics, like drinking enough water. We should all be drinking between 2 and 3 litres of water per day, and your caffeinated drinks do not count in that volume. So that's alongside your tea and your coffee. So many women avoid drinking water for fear of leakage. So pelvic floor dysfunction and bladder incontinence, they become quite common again when hormones start to fluctuate. But just because that's common, it doesn't mean it's normal. So if that's happening for you, please go and see a women's health physio, do the work and get to the root cause of those symptoms so that you can then drink the water. Pay attention to your bowel movement, because that tells you so much about your well-being. And particularly if you're constipated, that can really aggravate and exacerbate your hot flushes. So start to look to calm and to nourish the gut, to restore balance, to really get your gut health at the top of the list. But also make sure you're including enough fibre in your meals, that you're drinking enough water, and that you're adding in some dark green leafy veg to get things moving along. If we get a backup of excess estrogen because we've got a sluggish bowel, then that can cause an imbalance between estrogen and progesterone, and then it can cause the hot flushes. Stress has a massive impact on our hormones in general, but really can intensify any hormonal symptoms you're experiencing, and particularly hot flushes. So it's vital that you learn to identify and manage your stress. And it's not the big stresses, not the births, the deaths, the marriages, the moving house, the changing jobs, but the low-level stresses that chip away day after day, the little frustrations and aggravations that bubble under the surface, those things that bring your shoulders up to your ears, that make you breathe short and shallow, that disrupt your sleep because you're thinking about, that make you feel a bit angry or sad, or that you need chocolate to get you through the afternoon. Those things that put us into a constant state of survival and fight or flight. Start to look at what you can do to actively de-stress every single day. Managing your stress isn't about taking yourself off to a spa every 3 months for a day of relaxation, but doing something short and effective that starts to calm the nervous system and to bring your body back into balance. Balancing your blood sugar level is vital for managing not only your hot flushes, but so many other hormonal symptoms as well. So are you skipping meals? Are you leaving too long in between meals? Are you cutting out calories to try and combat the midsection weight gain that you might have started to notice creep on because your hormones are changing? That tends to be the first port of call. We get that frustration, so we cut the calories, we skip the meals, and we actually do more harm than good. So just check that you are eating all the goodness, that you're not going for fat-free and low fat, that you're eating quality protein at every meal to keep you fuller for longer. Again, manage your stress, because that has an impact on your blood sugar level. If you are having that mid-afternoon, I need chocolate because I'm going to rip the head off otherwise, then that's a stress response. But you have that chocolate to calm you down, you then spike your blood sugar level, which then crashes deeper, and then you've got that imbalance going on throughout the body for the whole day. So take it back again to basics. Eat regularly, eat real food. Have your good fats, your quality protein at every meal, and don't skip or leave too long in between eating. The right type of exercise can really help you to manage your hot flushes as well. And it can seem a little bit counterintuitive, but fight fire with fire. So if you're experiencing hot flushes, then look to add in some moderate intensity workouts. They just need to be short bursts, but it needs to include exercise that gets you a little bit out of breath, that gets you hot and sweaty, because that will help to reduce those flushes down. The other thing that is so helpful and that can reduce your hot flushes by up to 44% is strength training. I'm personally a huge fan of women lifting weights for bone health, for managing hormonal symptoms, and also for inch loss. So many women worry that if they lift weights, they will bulk up. But we don't have enough testosterone for that to happen even before hormones start to decline. If you choose to add in strength training, which I do really recommend, please be mindful of your pelvic floor and any pre-existing injuries, but go for a weight that is going to challenge you, because that's where the change will happen. When it comes to your hot flushes, you also need to identify your triggers. We are all different. There is no one size fits all. And it might be for you that spicy food or alcohol or a particular type of alcohol or your stressful days at work are the triggers for your hot flushes. So identify what's causing yours and then reduce or eliminate those triggers as much as you can. These strategies will take time to implement and to take effect. But in the meantime, when you feel a hot flush coming on, try this. Rather than grabbing the fan, stripping off, sticking your head out the window, wafting with a magazine, stop, take a deep breath out, and then try this breath practice. This is alternate nostril breathing. It stems back to ancient yoga. And if you do it in a yoga class setting, you would be taught the right mudra, you'd fold in the ego fingers, you'd position your hand in the right way. I'm going to share this strategy as just a general tactic to use when you feel your hot flush coming on. So you can use whichever hand feels comfortable. You can use your index finger, your middle fingers, you can rest a finger, you can fold in. Do what is right for you. The key will be to actually do this. So when that hot flush starts, you stop. You take a complete full deep breath out, let go of all the oxygen, and then place whichever hand is comfortable for you, the thumb by the nostril, close that nostril off and take a deep breath in through the open nostril. And then again, however it's comfortable, close off the opposite nostril, take the thumb away and breathe out. Now, when you start doing this, you might feel slightly lightheaded. If that happens, stop, go back to breathing normally and then try again. So let's just take that through, because you might need to do a couple of rounds, you might need to do a couple of minutes. But so many of my clients get instant relief when they feel their hot flush coming on and do this. So sit, relax, deep breath out, and we close off the nostril with the thumb. Take a breath in, close off the nostril with the fingers, whatever's comfortable. Take the thumb away, take a deep breath out, and then breathe in. Close off the nostril, take the finger away, and breathe out. One more time, breathe in, close off, take the thumb away, and breathe out. And you can repeat that cycle as many times as you need. And as you get more used to it, you might want to lengthen the breath. So initially you might just want to breathe in for 4, block off, breathe out for 4. You might then lengthen that to breathe in for 8, breathe out for 8. You might want to breathe in for 4, close off both nostrils and hold for 4, and then breathe out for 4. When you implement these strategies, you should notice a change in your hot flushes, in the frequency and in the intensity. But please don't ever just accept this is the way it has to be, that I'm going through hormonal changes and I have to have these symptoms. You don't. Any symptom that shows up is your body trying to get your attention. It needs something from you, whether that's better nourishment through food, through exercise, through stress management strategies, from some rest and some relaxation. Take the signal and do the work. Listen to your body, dig deeper, find out why it is presenting this symptom. If you want some more ideas for balancing your hormones, then please do download my free 6 Steps to Happy Hormones guide. The link is in the description, and I'll see you next time.